airway, and breath. Following every set of 30 compressions, proceed to open the airway and provide 2 rescue breaths, a breath a second. Your ability to administer breaths will further assist the victim. Before administering breaths, it's crucial to clear the airway and confirm there are no blockages, with the tongue being a common obstruction. If there's a visible foreign object that can be easily removed, take it out. Engage in the head tilt chin lift maneuver or a jaw thrust maneuver. Opening of the airway, performing a head tilt chin lift. Adhere to these steps for executing a head tilt chin lift. Position one hand on the victim's forehead, using your palm to gently tilt the head backward. Place the fingers of your other hand under the bony section of the lower jaw, near the chin. Elevate the jaw to bring the chin forward. While conducting a head tilt chin lift, ensure to refrain from exerting excessive pressure under the chin, as this might obstruct the airway. Avoid completely closing the victim's mouth. Tilt the head back while pinching the nose with one hand. Simultaneously, use the other hand to lift the chin, effectively opening the airway. Jaw thrust maneuver. When the head tilt chin lift is ineffective or in cases of suspected spinal injury, resort to the jaw thrust technique. Follow these steps to execute a jaw thrust. Position yourself at the victim's head. Place one hand on either side of the victim's head, possibly resting your elbows on the surface supporting the victim. With fingers positioned beneath the angle of the victim's lower jaw, employ both hands to lift and push the jaw forward. In case the victim's lips close, utilize your thumbs to separate the lower lip, ensuring the lips remain parted. If the jaw thrust fails to open the airway, resort to a head tilt chin lift. Breaths. Ensure the airway is open, pinch the nose, and deliver air into the victim's mouth. Seal your mouth firmly over theirs. Use a protective barrier if accessible. Administer 2 breaths, each lasting for 1 second. Confirm that the chest rises and falls between each breath. Methods to administer rescue breaths for CPR. Mouth-to-mouth technique. Ensure the airway is clear of any obstructions. Tilt the head back slightly to open the airway. Pinch the victim's nose shut. Take a normal breath, make a complete seal over the victim's mouth, and deliver a breath that lasts about 1 second. Watch for the chest to rise and fall. Barrier devices. Use a CPR face mask or shield to prevent direct contact. Position the mask over the victim's mouth and nose, ensuring a secure seal. Deliver breaths through the one-way valve. If the breaths you provide do not enter, continue performing chest compressions following the 30:2 ratio until the breaths are effective. Avoid pausing compressions for more than 10 seconds. Continue the cycle of 30 chest compressions and 2 rescue breaths, maintaining a rate of at least 100 to 120 compressions per minute until the arrival of an AED, EMS, or the victim exhibits signs of breathing. If the individual starts breathing, gently roll them onto their left side into a recovery position while awaiting EMS. In the recovery position, any vomit or fluids will naturally drain from the mouth. When moving the victim, take special care to support the neck, head, and back. Please note that hands-only CPR is a critical, life-saving technique ideal for situations when a bystander does not feel comfortable performing mouth-to-mouth resuscitation or lacks a face shield or pocket mask.